Doctors are medical professionals who diagnose and treat patients. They have disease process from diabetes to heart disease to urinary tract infections, pneumonia, cancer, all diseases. They follow diagnostic process, pre-existing set of categories agreed upon by the medical profession to designate a specific condition, and a review of clinical reasoning. But in this pandemic, PCR test result decides whether an infected person should self-isolate or not, even if it's not 100% reliable. According to Dr. Fauci, a positive test using a cycle threshold of greater than 35 is essentially worthless. And yet, there are records that 37 to 45 CT value was being used by most globally. Most people are not aware of the CT value we are using. In our case, when someone in the family tested positive, the whole family is isolated. But isn't it inhumane to isolate sick people with non-sick people and then we ask why everybody in the household gets sick? They have used to make us believe that this virus was from an animal to human, but it was never proven. Evidence is strongly pointing that this could be a man-made disaster. Footage of live bats inside WIV, interview of Peter Daszak in 2019. China's COVID-19 cover-up. WIV workers diagnosed with unknown respiratory illness in mid-October and November 2019. And many more. Now, a mass vaccination globally of the vaccine that have been made in the past months. COVID-19 vaccines that were approved because of the emergency use authorization. And yet, WHO and other major institutions are strongly against the existing ivermectin medicine that were proposed, tested, and used to treat and prevent COVID-19 by some doctors and experts around the world. Despite meta-analysis show positive results, WHO said it lacks clinical trial. Several COVID-19 variants are now coming out and the authorities are not sure if the existing vaccines will be effective in all variants. Research are still ongoing. The mainstream narrative have lacked in promoting early treatment and instead, they are focusing on the daily monitoring and announcement of the number of COVID-19 positive. In the Philippines, it always happens. The solutions are more on restrictions, quarantine, or lockdowns, instead of educating people to be socially responsible. This pandemic could take longer. Millions of people have died already around the world, thousands in the Philippines. Everyone should be socially responsible and engaged to solve the problem. Take proper precautions instead of shutting down businesses. Be strict on sanitation, especially in public transportation and places. Businesses went bankrupt. People are losing their jobs. Many are dying because of hunger, suicide, and depression. The government have borrowed trillions responding to the pandemic. We should have a concrete plan and everyone should take part because COVID-19 is a war against the invisible enemy. Even if it ends, this could happen again. I am Lovely Montoya of Manila STV.